So you see, 10 years ago, many parents were worried about how to pay school fees. Today, another question is becoming important. I say, how can people stay healthy before become seriously sick? So in between these two questions, Ghana introduced you free SHS, digital health service, medical drone, new hospitals, cash support for families, and free primary health care. At first, this policy may look like different events, but when you put them together on one timeline, you begin to see a bigger picture. You see, over the last 10 years, Ghana's social policy have changed in three main ways. Way number one is the expanding access, and the second one is the building capacity. The third one is focusing on prevention. This is the story of how Ghana's social support system changed from 2016 to 2026. All right, so our story started in 2016. You see, that year, Ghana introduced the National Social Protection Policy. You see, the goal was simple. I say, bringing different support programs together under one umbrella or one plan. So programs like National Health Insurance, LEAP, and school feeding program all became part of a bigger system. You see, then came 2017. You see, 2017, government introduced free SHS. Because of free SHS, family no longer had to pay any approved fees. This gave thousands of students many chance to continue their education. But more students also met more pressure on classrooms, dormitories, and teachers to manage the large numbers. Ghana introduced the double track system. Thereafter, in 2018, Ghana introduced the NHIS renewal digital system. Thus, you'll be able to renew your health insurance through the short code *929. Yes. So people no longer have to wait in a long queue before they can renew their health insurance. So in 2019, Ghana introduced the Zipline medical drone. This drone carried blood, vaccine, and medicine to remote communities. The goal was simple, making service easier to reach. So then came 2020, COVID-19. The COVID-19 changed everything. The pandemic shows that support must work during difficult times. And you see, during the pandemic, support programs was expanded. So LEAP continued payment. Water and electricity relief was introduced. Food support reached many communities. The goal was to help families through difficult times. The pandemic also revealed another problem. That problem is that some community did not have enough health facilities. So in 2021, Ghana introduced Agenda 111. Yes, that project, the aim was to build hospitals in some part of Ghana. The idea was to improve access in healthcare across the country. By 2024, attention turned into new law. The Affirmative Act action was passed to improve opportunities for women in leadership and public life. So social support was becoming more organized and more targeted. Then came another major change. You see, in 2016, Ghana launched free primary healthcare in selected districts. That policy is different from earlier programs. Instead of waiting for people to become seriously sick, the goal is to find health programs earlier. People can reach free screening conditions like high blood pressure, diabetes, and some cancers. At the same time, the LEAP program was reviewed. Some households that had improved financially left the LEAP program. New valuable households were added. The goal was to make sure that people who need that LEAP program can be reached. When you look at the last 10 years, pattern appears. You could see from 2016 to 2019, the focus was on expanding access. From 2020 to 2023, the focus was handling crisis and building facilities. From 2024 to 2026, the focus moved towards prevention and targeted supporters. This change did not happen overnight. You see, they came through many policies, many programs, and different governments. But the big question is, can Ghana continue improve this system to make sure every Ghanaian benefits? So you as a Ghanaian, let me ask you, which of these programs did you benefited most? Was it free SHS, National Health Insurance, digital renewal? Was it LEAP or Agenda 111 or free primary healthcare? Tell us in the comment section.